Quality assurance and quality control in clinical laboratory. What is quality? Laboratory quality can be defined as accuracy, reliability, and timeliness of the reported test results. The laboratory results must be as accurate as possible. All aspects of the laboratory operations must be reliable, and reporting must be timely in order to be useful in a clinical or public health setting. If inaccurate results are provided, these are the consequences that can be very significant. Failure to provide the proper treatment, delay in correct diagnosis, additional and unnecessary diagnostic testing, unnecessary treatment, and treatment complications. Important elements of quality management system. First, we have documentation, standard operating procedures, quality control samples, external quality assessment scheme, or what we call proficiency testing. Quality assurance. The WHO definition of quality assurance is a total process whereby the quality lab results can be guaranteed. Quality assurance is aimed at ensuring quality test results. The purpose of quality assurance is to give relevant, reliable, timely test results which is interpreted correctly. Quality assurance involves activities both inside and outside the laboratory, good laboratory practice, and proper management skill. Quality assurance includes monitoring and controlling of competence of personnel, quality of materials, methods, reagents, and instruments, reporting of reliable results. Quality assurance is the maintenance of the overall quality of patient results. All the factors that affect the test results from the time of the test. For pre-analytic variable, we have specimen collection, specimen transport, specimen quality. For analytic variable, we have result accuracy, clerical errors, analytical errors, assay repeat rates. And for post-analytic variable, we have result reporting, record keeping for patient and quality control. Quality control covers the part of quality assurance which primarily concerns the control of errors in the performance of tests and verification of test results. Quality control must be practical, achievable, and affordable. The primary aim of quality control is to do the test reliably. Quality control activities include selection, which covers the analytical management range, low, normal, and high. For frequency, it is the stability of method, risk of harm to patients, which clinical action that can be taken before an error could be detected. And lastly, for evaluation, also known as statistical QC, permits assessment of a method performance and detection of trends. Quality control can be implemented in two ways. First, we have internal or intra-laboratory QC performed by individual labs at their own levels. It forms the day-to-day basis working quality assurance. Second, we have external or inter-laboratory QC performed by many labs at the same time, monitored by one. It is highly costly. For internal QC, it monitors the daily precision and accuracy of methodologies, personnel, and instruments. It includes measurement on specially prepared materials, repeated measurements on routine specimen, as well as statistical analysis day by day of data obtained from the test which has been routinely carried out. For external QC, it is also called proficiency testing, which evaluates a laboratory's testing results by comparing them to these of similar laboratories. Specially prepared specimens are obtained by multiple laboratories participating in the proficiency testing program. These unknowns are then tested by participating laboratories and test results returned to the proficiency testing program. Let's see the difference between quality assurance and quality control. For quality assurance, it aims for the management system to guarantee integrity of data, while for quality control, measurement used to check quality of analytical data. For quality assurance, it is everybody's business, and for quality control, restricted to specific area and performed by authorized staff. For quality assurance, the goal is value addition, and for quality control, the goal is error detection. Quality assurance aims for management strategy, and for quality control, it aims for error detection methodology.
Know what instruments you need for local testing to ensure that you maintain sufficient supplies and that they are not out of date or deteriorated. Always have sufficient and appropriate personal protective equipment and use it. Consult the Material Safety Data Sheet, or MSDS, for the proper safe use, storage, transportation, and disposal of a reagent. Ask your operating lead or designated trainer for guidance in how to use testing equipment, including how to calibrate using standard solutions. A standard solution is a known concentration of a particular chemical or analyte. Standard solutions can be purchased from the manufacturer. In the illustration of the regional water treatment plant featured in these videos, standard solutions are used to calibrate the laboratory turbidimeter, the colorimeter, as well as the handheld turbidimeter and pocket colorimeter used for field work. Each instrument has its own set of standard solutions. It's essential that you familiarize yourself with the manufacturer instructions for calibrating each instrument. In this illustration, the operator is using secondary standards to calibrate a lab turbidimeter. The operator has assembled the standard solutions and the facility's QA/QC log. The operator cleans the first standard solution with a lab wipe, aligns it in the instrument as required, closes the cover, notes the reading, and records the instrument calibration reading in the QA/QC log manual. The first standard solution is removed. The second standard solution is wiped and inserted into the instrument. And the reading recorded in the log manual. The process is completed for the third standard solution and repeated a fourth time in this illustration. Preventative and routine maintenance, including calibration, are requirements for every piece of analytic equipment in your facility. Effective operational support is undertaken to adhere to proper sampling techniques as set forth in a facility standard operating procedures and